To watch the latest from India Science, don't forget to subscribe to the channel and press on the bell icon to get notifications on all the science related videos.
Namaskar, you're watching India Science and we are talking about our series Let's Talk Health. We bring to you a conversation with none other than the man of the moment, Dr. Randeep Guleria, Director, the very prestigious All India Institute of Medical Sciences. Thank you for joining us, sir. We are indeed grateful for your time. My first question would be to you, as all Indians are asking today, are we in the midst of a second wave? Or the beginning of the second wave?
So if you look at the data over the last few weeks, we are seeing a rising trend in certain states. Maharashtra is one of them, and certain states in the south. This does suggest that we are heading for a surge in the number of cases. So we could say that we are looking at a new wave. What we can do, or what is in our hands, is to see how we can make sure that this wave is not as big as the previous waves, and how we can bring it down as early as possible. But yes, as compared to how we were 3 to 4 weeks ago, the number of cases has increased. So we are seeing a surge in the number of cases.
Sir, my question to you is that when we spoke last time, you had mentioned about the Spanish wave and how India needs to be cautious about the second wave. And if we look at the surge in numbers, we need to vaccinate over 50 lakh people a day. But we're only able to do 20 lakh vaccination a day. Why is that, sir?
So as we move along, we need to really increase the number of vaccination sites. But also there's a little bit of vaccine hesitancy. Even if you look at the numbers today, we are doing 20 lakhs and gradually it's going up. But it's not that there's a shortage of vaccine or there's a shortage of sites. There are still empty slots available. We don't have a waiting that is there in terms of vaccination. So I think we need to really push people and ask them to come forward. We need to develop strategies of reaching out to people. There may be people who are in the priority list in the high risk group, but for some reasons are not able to come to the vaccination center. So reach out to them, develop strategies so that we can vaccinate those. There may be many in rural India who are not tech savvy. So how do we really develop volunteers who can go to their house and fill up the data or bring them to the vaccination site? So innovative measures which may be region specific need to be developed. But I would say that gradually the numbers are picking up, and we need to encourage more and more people to come forward and get themselves vaccinated, because once we're able to finish the priority list that we have right now, we can move forward and vaccinate more and more people. And that is very important if we need to really decrease the number of cases that we are seeing in this new wave that is happening over the last few weeks.
So why is primarily the surge happening in these states is my question now. People are asking about the new variants. How bad are the new variants and why is this mutating to such an extent? Over 4,000 mutations already done, plus more.
So mutation and variants will develop. This is known, and this we know way back even from February of last year, that there are going to be variants. The virus does mutate, and there may be some mutations which are of not that much of clinical significance. So we look at mutations which have clinical significance. And those mutations could have a significance when we look at the virus becoming more infectious. So the virus may mutate naturally in an individual and change its profile so that now it's able to infect more easily and attach to the human cells much more easily. That is one way of mutation. The second way is the virus may become more virulent. It may cause more severe disease and cause more deaths. And third is, which is more of a concern, is that the virus mutates in an individual who already has some degree of antibodies. And the virus then mutates to develop an escape phenomena so that it is able to bypass those antibodies and becomes what is known as immune escape phenomenon. That is a cause of concern, and that is what is being investigated in detail, because that means that this new variant will infect those who already have been infected in the past, and also will cause some degree of infection in those who have been already vaccinated. As of now, the data that we have with the South African variant, the Brazilian variant and the UK variant does not suggest that there is this immune escape phenomena. There is some data which suggests that there may be a little bit of higher hospitalization. But yes, the UK variant and other variants are more infectious and are more rapidly spreading. That is why now with this increasing surge, the strategy that we need to develop is that we need to really make sure that we break the chain of transmission, don't allow the virus to spread. And that is why COVID appropriate behavior and vaccination become very, very important if we want to decrease this new wave that we're seeing.
So, doctor, you're saying that this wave, the new variant wave, is more infectious. So, we need to be more aggressive in our approach towards the control of the same. But what exactly is the difference between the UK variant and the Brazilian variant? Because the Brazil variant is something like B414, what I got to know. What is that factor in that variant that is causing so many alarm bells?
So that is one mutation 485, which makes this virus a little bit more, has a higher chance of developing some degree of immune escape. The UK variant was more infectious. The concern is that the Brazilian variant may also be able to have some degree of immune escape mechanism. But whatever data we have, including with the vaccines that are being rolled out, suggests that although the immunity may come down a little bit, because of when you are infected with this new variant, the vaccines may still be effective. Remember, we have vaccines where the efficacy is very high. It's 70, 80, 90%. So even if the efficacy comes down a little bit, it comes down by, let's say, 10% because of a new variant, we still have enough buffer to be able to say that the vaccine is still effective. So we haven't reached a stage where we say that the efficacy has come down so much that now the vaccine will not work. The vaccine will work. And secondly, I think when we're talking of how the vaccine works, it's important to understand what are we talking of. Are we saying the vaccine to prevent infection, that is, no one should get COVID? Or are we saying the vaccine to prevent a person from getting severe disease? The vaccine will work in protecting an individual from severe disease. He will not require to be hospitalized or go to the ICU. It will decrease deaths. That we definitely know. Yes, if there is a decrease in their immune protection, you may get the disease and you may be infectious. And that is why, along with the vaccine, COVID appropriate behavior becomes all the more important. Because no matter what be the variant, if you have COVID appropriate behavior, if you wear your mask, if you have physical distancing, if you wash your hands, if you avoid crowds, the virus cannot spread. So all variants will get blocked and you will break the chain of transmission.
Absolutely. And as we talk, we see elections in 5 states, so many road shows and rallies. How are we ever going to prevent people from, this kind of a COVID appropriate behavior? And there should be some kind of punitive action, since I think the doctors and frontline health workers have put an entire year, slogging out for this kind of messages to be given to the public. How do you inspire them to, be careful?
So that's true. I think what I would just like to say is that all of us, and this is not only doctors or healthcare workers, but everyone, the whole nation has worked hard in the last 1 year to reach where we are today. People have sacrificed a lot of their freedom, their holidays. School children have sacrificed schoolwork, and a lot of people have moved on to online jobs. There are people who have lost their jobs. And so all that sacrifice will be in vain if now, when we are at that point where we say that it's just a few more months and we should be able to come out of this pandemic, we sort of stop all those measures and go back to a situation where there would be a huge surge in the number of cases. So I think this is the time when we should sort of revitalize ourselves, understand the importance of COVID appropriate behavior and getting vaccinated as early as possible. These are the two sort of weapons that we have. One is COVID appropriate behavior, because we have to prevent the virus from spreading from one person to the other, and that is going to happen only with COVID appropriate behavior. Secondly, we need to protect our citizens and also have a good amount of immunity in the population so that the virus causes less severe disease or doesn't actually spread from one person to the other. That can happen only with vaccination. So these two weapons that we have are so important in our fight against COVID-19 that we need to really push that aggressively. And I would just say that we may need to take punitive action, we may need to be aggressive, but if people understand the responsibility, if we really understand that this is a fight in which every citizen has to be involved and understand that, look, for a few more weeks or months, if I don't go on a holiday, it's not going to matter, but it will make a big difference as far as the country is concerned. Let me do that. Then I think we should come out of this pandemic.
And as you said, Dr. Guleria, nation comes first. And on this note, we are going in for a short break. When we come back, we'll ask Dr. Guleria some more questions. Stay tuned.
India Science Channel was launched in the year 2019 by the Department of Science and Technology, Government of India. The internet-based dedicated science web channel is being implemented and managed by Vigyan Prasar, committed towards science communication. The channel features science documentaries, discussions on current topics, interviews, and different programs covering the entire landscape of science and technology to make science popular among the masses.
India Science is a flagship project of Vigyan Prasar. And over a year and a half, we have produced more than 1,200 videos of different sizes, lengths, and are from different genre and for different domains for the people of the country. We've spoken, we've dived deep into the realms of different domains of science and technology, and we have gotten news, stories, films, videos in almost every format that you can think of. OTT, for that matter, is a great platform that helps anybody to look for any news, any item, any video, any documentary at any point in time. All you need to do is to subscribe a channel for it.
One can also download India Science mobile app from Google Play Store or Apple Store to view this channel.
Welcome back, and we are talking to Dr. Randeep Guleria, Director, All India Institute of Medical Sciences. We are asking him questions about the surge in numbers. Sir, if we look at the surge, we also look at vaccination, which you said is a very big weapon that India has. And we must today applaud the scientists of our country for this wonderful vaccine and our Honorable Prime Minister for the vaccine Maitri that is going on. It's a big heads up for India. But as we talk about this, there are apprehensions. People are asking, should I take Covishield? Should I take Covaxin? Or should I wait for the nasal spray? How do we allay these fears?
First of all, I'd like to say that two things. One is both vaccines are equally effective. There is now very good data from both the vaccines, and therefore I would say that whatever vaccine one is able to get, he should take it as early as possible when his or her turn comes. So if you're in the priority list, if you're over 60 years of age, if you're between 45 to 59 years and you have comorbidities, please come forward and take the vaccine. It will help you. And whatever vaccine is available near you, take that. There is now data which suggests that both of them are useful. Both are equally effective. There is good data in international literature which has been published. And I think it's a huge achievement for India that we've been able to get two vaccines which are locally made. Most countries have not been able to do that. And we have a whole supply chain in terms of the vaccine availability, but even ongoing research to develop new vaccines, which will also add to our armamentarium in terms of vaccine. So that is something which is a great achievement by our scientists, by the entire community, whether it's the research community or the industry, which has come together, collaborated together and worked in making the vaccine. Second is that I personally feel vaccine Maitri is very, very important. We have to vaccinate the world if we have to come out of the pandemic. It's not vaccinating a country or one region. And this is what has been shown even in the past. If we look at what has happened, if you don't vaccinate one area and the pandemic continues there, viral replication will continue happening in that area. More variants will develop and these variants may be resistant and they will then come to the other part of the world. No part of the world is in isolation.
Yes,
Therefore, if we don't have a vaccine Maitri, we are actually allowing variants to develop, because variants development is directly linked to the number of viral replication that happens. So if you have a large number of people who have the vaccine and who are protected, the chance of the virus replicating becomes less. The less replication, the less chance of variants developing. And we have to be able to vaccinate as many people as we can globally rather than nationally to really prevent this.
And when we talk about, say, air travel, and people are, because of the pandemic fatigue, wanting to travel abroad or travel in India to sort of go and meet their grandparents or parents. It's been such a long year of not stepping out. What do you do if passengers, kind of behave aggressively in an aircraft? You can't just get out of the plane or walk out of the window or jump out of the window. You are in a place where it is highly infectious. So what kind of actions need to be taken?
So we need to be aggressive there, because I think wearing a mask or washing your hands or trying to have a COVID appropriate behavior,
or even that headgear which is given in the aircraft,
having a face shield also, are all very important. And it's not as part of protecting yourself, it's a part of a social responsibility. When you're in an aircraft, it's your responsibility not to only protect yourself but protect your fellow passenger. And if each of us does that, we will be able to protect each other. We already know that this is a very clever virus. It may be present in your nose and throat without causing any symptoms. So you may feel that I have no symptoms and if I don't have COVID, but that's not true. You may be having COVID and therefore
asymptomatic,
you may be asymptomatic, and you may be on a flight, and if you don't take this precaution, you are exposing your neighbors who are sitting with you on the flight to getting the infection.
There is one passenger who said very recently that the virus is transmissible through the eyes. Now, what can we say to that? Because he said that I'm not wearing a mask.
No, we have enough data. You have to go by the science. There is enough scientific data that suggests that this is a virus which is through droplets, and therefore when you breathe, you cough or you sneeze, the virus is through droplets comes into the air, and like all other respiratory viruses, if you come in close contact with such a person, the infection will travel to you and you will get that infection. If we develop a barrier, which could be in the form of a face mask, a face shield, then we are preventing the virus which is present in an asymptomatic person's nose or throat to reach out into the environment. And therefore, if both people are wearing a mask and have a face shield, the chances of a person transmitting it from one to the other becomes very, very little. And that's how we are protecting each other. So that is why in a closed environment like an aeroplane, wearing a mask, having a face shield is very, very important. And people are not following that as they should.
Also, doctor, now if we look at countries like Denmark, Norway, Brazil, the European Union, there is some kind of a message sent out to AstraZeneca that they've been banning it and suspending the vaccine for some time. And if we look at Covishield, which is in sync with the same vaccine, collaborating with that, how do you look at people's apprehensions here in India?
So based on whatever data they had, there was a little bit of a concern. It started off in Austria, and then of course in the Scandinavian countries, Denmark, where there was a report that people developed clotting in the blood, which was known as pulmonary embolism and other parts. Two patients actually died, and there were a number of patients who had some degree of clotting. But the issue is the cause and effect. Is this because of the vaccine, or did it happen on its own? Because we know that a large number of people who are vaccinating, who are the high risk group and who are elderly, have a higher chance of developing clots on their own also. That's why many of them are on blood thinners or anticoagulants. Therefore, that is what is being investigated. But we must also understand that this vaccine has been given to a large number of people in UK, even in our country. Bulk of the vaccine that we're giving is Covishield. And we haven't seen that being reported in as a side effect, although all our vaccinated individuals are being followed closely. Therefore, I don't think that it's a major cause of major concern. But because we want to have good, robust data that the vaccines are safe, anything which happens while a person has been vaccinated is investigated, and that is what is being done. The European Medical Agency has said that these vaccines are safe, but they're just looking at the data. And that's why I think we should continue to vaccinate as is being done in various parts of the world, including UK.
Absolutely. And on that note, we're going in for a second break. Stay tuned. When we come back, we'll talk to Dr. Guleria about what precautions you and I need to take.
India Science Channel was launched in the year 2019 by the Department of Science and Technology, Government of India. The internet-based dedicated science web channel is being implemented and managed by Vigyan Prasar, committed towards science communication. The channel features science documentaries, discussions on current topics, interviews, and different programs covering the entire landscape of science and technology to make science popular among the masses.
India Science is a flagship project of Vigyan Prasar. And over a year and a half, we have produced more than 1,200 videos of different sizes, lengths, and are from different genre and for different domains for the people of the country. We've spoken, we've dived deep into the realms of different domains of science and technology, and we have gotten news, stories, films, videos in almost every format that you can think of. OTT, for that matter, is a great platform that helps anybody to look for any news, any item, any video, any documentary at any point in time. All you need to do is to subscribe a channel for it.
One can also download India Science mobile app from Google Play Store or Apple Store to view this channel.
Welcome back. We are in conversation with the Director AIMS, Dr. Randeep Guleria, and we are talking about whether or not we are in the beginning of a second wave. So, if we look at data in India and people on the road, it is saddening to see that people are avoiding, all COVID precautions. And as Holi is approaching now, there are a lot of parties happening, there are a lot of get-togethers happening. It has been happening over the last few weeks now. That fatigue has set in. What would be your message to India?
So I agree with you that there is what we call COVID fatigue and a dramatic decrease in COVID appropriate behavior. Even told a few people outside that why you're not wearing a mask, and they become aggressive and they say that this is my own individual right, and if it's my wish whether I want to wear a mask or not.
I choose not to wear it.
But I've been telling them it's not your choice, because it's a social responsibility, because you can cause infection to others, and you may not wear a mask if you felt you are willing to get the infection, but you could give it to others. And therefore I would say that this is the time when we should re-emphasize and say that the importance of what we did a few months ago is even very, very relevant, and that is COVID appropriate behavior. If we look at the whole situation right now, the number of cases are increasing because the virus has not gone away. The virus is still there in the community, and we are talking of new variants which are more infectious. Therefore, if we really need to get over the pandemic, if we need to get our economy back on track, if we need to have people going on holidays and feeling safe, if we need to have schools and colleges opening in the way they were in the pre-COVID era, then COVID appropriate behavior for the coming months is very, very important, because we don't want to have another surge and have everything getting delayed by months or even for the whole year.
So another thing that I'd like to ask you is, how do you think industry should come forward now? कि अगर हम farmers की बात कर रहे हैं या factory में काम करने वाले लोगों की बात कर रहे हैं, so they also need vaccination. They're also not tech savvy, as you rightly mentioned. तो क्या हम कोई outreach program कर सकते हैं? We can perhaps reach out to them on their doorstep, like we had something in pulse polio, and they need to be vaccinated as soon as possible.
So I think that can be done, and that is something that is also being looked at. That if you look at industries or areas where there are factories and there are colonies of people living there, one can develop strategies that their healthcare facility there can become a vaccination site, and the industry can help the workers or their parents and the high risk group to come first to the vaccination site and get themselves vaccinated. And then gradually, as we move to the next phase, more and more people can get vaccinated, because even in certain industries, two things are very important. One is, in many industries, people have to stay close to each other, and it becomes difficult to have that COVID appropriate behavior. And if one person gets infected, it affects the whole industry, and that leads to
cluster, absolutely.
a cluster occurs, and that leads to a decrease in the output of that particular industry. So that is an important thing. And with time, we need to develop strategies of vaccinating industrial areas where there are colonies, and even the workers' parents are staying there. All of these areas do have small hospitals, they have health centers. These can become vaccination sites, and I'm sure that we can vaccinate more and more people in these areas with
and
the
reach that
support
50 lakh
of the industry,
Yes,
because then they can help in
absolutely.
getting these people to the
And I would
vaccination
also
site.
like to mention to you and maybe request you from this forum today that people with disability who are not able to come, at least that reach out must happen by the GOI. Also, Doctor, there are certain myths that we need to bust. चलते चलते मैं ये जानना चाहूँगी कि कई सवाल हमारे पास रोज YouTube पे आ रहे हैं on India Science. People are asking, I'll become impotent if I take this vaccine. Another question which is coming very often is, मेरा धर्म भ्रष्ट हो जाएगा वैक्सीन लेने से. क्या कहना चाहेंगे आप आज सर?
अली जी, तो मैं ये कहना चाहूँगा कि देयर इज़ नो डेटा वेदर इट्स मेन और वुमेन कि आप इम्पोर्टेंट हो जाएंगे. देयर इज़ रियली नो डेटा, एंड दिस इज समथिंग विच इज़ मॉनिटर्ड वेरी क्लोजली फॉर ऑल द वैक्सीन्स. आई एम नॉट टॉकिंग ऑफ ओनली जो इंडिया में वैक्सीन है, लेकिन जो बाहर वाली वैक्सीन भी हैं, उसमें कोई ऐसा डेटा ही नहीं है कि आप इम्पोर्टेंट हो जाएंगे. रिगार्डिंग इशू ऑफ धर्म भ्रष्ट और रिलीजन इशूज़, even before there was this whole story that the vaccine has spoke and people were saying you should not take it, there is really no data, and there is really nothing of that nature.
Yes.
Because the vaccines are made in laboratories, they are made by various mechanisms, and a lot of processing is done. So there is no animal products per se which are used in these vaccines. I would argue the other way around. I would say if you get COVID, then you may have a problem, because this virus has come from animals. This is a virus which has come from animals and jumped species. So getting COVID may cause more of dharam brush than the vaccine itself, and that is why it's more important for you to take the vaccine.
So on that lovely note and pragmatic note, I'd like to thank you for joining us today, and may India excel further, and may this outreach program of India and Vaccine Matri see the next level. And thank you so much once again for joining us, and maybe win the marathon fight against Corona. Thank you so much, Dr. And to all our viewers, we just watched a very interesting conversation with Director AIMS, Dr. Randeep Guleria. He said, wear that mask, have COVID appropriate behavior, and go vaccinate yourself, India. On that note, this is a wrap on this edition of Let's Talk Health at India Science. Keep watching India Science. Namaskar.